Okay, thank you very much for getting us started, Enrique. Let me invite the next panel to go up to the front of the room while I do introductions. So happily, this next panel has the task of not only identifying gaps, but starting to talk about solutions. It will be moderated by Ramanan, who is at the Center for Disease Dynamics, Economics and Policy, and also Vice President of Research and Policy at the Public Health Foundation of India. We also have Nanka van der Broek, who is a professor in maternal and newborn health at the Liverpool School of Tropical Medicine. She established and leads the Center for Maternal and Newborn Health, which is a WHO collaborating center, and has conducted large RCTs in Asia and Africa of single interventions for improved maternal and newborn outcomes. We also have Jishnu Das, who is a lead economist at the World Bank and visiting fellow at the Center for Policy Research in New Delhi. His work focuses broadly, not just on health, but in other areas, and in health on quality and mental health as two of his interests. And hopefully, oh, hi, Ed. Okay. We have Ed Kelly with us from WHO. Ed is Director for the Department of Service Delivery and Safety at WHO. He has responsibility for many, many things, but I will shorten it to strengthening safety efforts, quality, integration, people-centeredness, and as if that's not enough of a job, he has recently been named as the lead for infection prevention, safety, and health system recovery for WHO's Ebola efforts. We really appreciate you being here. Ed, we know you have a few other things to be attending to. So Ramanan.
Thanks, Sheila. So this panel is charged with synthesizing evidence and identifying the gaps, which seems to be the whole meeting in a sense. But thankfully, you all have to do it and not me. One thing, if the comments that you make before we get into the discussion, it might be helpful to start getting fairly concrete about what some of these gaps are. I think we've heard a lot about sort of working around the edges of gaps in information and knowledge. And clearly we need to know more about the efficacy of these current interventions, the components of what makes up these interventions, but perhaps interventions that we haven't actually even discussed here. But do we really even know what questions to ask before we get around to answering anything? What are the questions that really matter? So if we could have some attention to that in your comments, if we can start with you, Jishnu.